Hi, my name is Dr. Mark Lewis. I'm the Director of Gastrointestinal Oncology at Intermountain Healthcare. So I've just been speaking here at Total Health Conferencing in Denver, a Best of ASCO review, and I was specifically addressing advances in colorectal cancer from the 2022 ASCO annual meeting. There were three abstracts I discussed. The first, of course, was the late-breaking abstract about dostarlimab in locally advanced rectal cancer. That was, of course, MSI high with 12 out of 12 clinical complete responses that so far appear durable. And this is super exciting because it tells us there is a subset of patients with rectal cancer who might be treated exclusively with immunotherapy and spared chemo, spared radiation, and spared surgery. That was, of course, a huge newsworthy presentation at ASCO that lots of patients heard about, which means it's important for us to know about. The second trial I spoke about was the dynamic study that looked at ctDNA analysis in the selection of adjuvant chemotherapy for stage 2 colon cancer. And I think we're entering an era where we've always known there are a group of stage 2 colon cancer patients who are at higher risk, and now we can more readily identify those patients with MRD, know that those patients need adjuvant chemotherapy, and on the flip side, patients who are MRD negative might actually not need adjuvant chemotherapy. Doesn't mean we entirely dispense with our traditional decision making and consultation with our pathologists, but it's an exciting move in the right direction of being a little bit smarter about who gets chemo and who doesn't. And then finally, I talked about the Paradigm study, which was presented at plenary. This looked at the role of panitumumab as the first-line biologic agent in conjunction with FOLFOX in metastatic colorectal cancer. And again, specifically a left-sided RAS wild-type population. We talked about how the survival benefit does appear to be there for panitumumab over bevacizumab in a way that you might not get if you go in the reverse sequence. So it really does matter, I think, to know the mutational status and sidedness of our metastatic patients when we're making our first-line treatment decisions. So all in all, I think this was a great meeting. I think the ASCO annual meeting was really exciting. And most of all, I'm excited that it's making patient care better. Oncologists like myself, like you watching, can now be smarter when we make recommendations for treatments to our patients. And our patients can know that their treatment is being more individualized for them.